Lisfranc injuries are ones that I have really only ever seen in football, though I'm sure that there are others that you can see them in as well, but generally that's the sport that you will notice these injuries in. With this injury, it is really a two-part injury. You end up with a disruption of the tarso-metatarsal joint and oftentimes have an associated fracture. So what you will see is that the first metatarsal is typically going to be dislocated from the first cuneiform. And then, in addition, the other four metatarsals are displaced laterally because of that original problem. There are three main mechanisms of injury that you will see with this problem. The first includes those that have occurred because of indirect forces. So you may have a plantar flexed foot with the heel off the ground and a person ends up with an axial load that goes through the foot. You may also see a foot that's been externally rotated and hyperpronated, and you end up with weight being applied to that first metatarsal. You also can have an indirect force of when the foot is in extreme plantar flexion and is subjected to an axial load that can cause the second metatarsal to dislocate dorsally. These are things you're not necessarily going to be able to see, but this is simply a athlete's body weight that is causing that indirect force. Direct forces is simply having a heavy object fall on the foot. You can also have a severe twisting injury, and these are ones that football players tend to remember. And an example would be a football player falls on the heel of another player's foot that is plantar flexed, and this causes an axial load along the metatarsals. Signs and symptoms of this injury include things such as a medial midfoot edema and ecchymosis. Again, think about where this is. This is where the metatarsals meet the cuneiforms, so it's going to be more the midfoot. There will be localized pain at the tarsometatarsal joint, perhaps a paresthesia. You may notice a flattened arch. There may be medial step-offs, and there will definitely be midfoot pain. Range of motion wise, we aren't really testing range of motion within the foot itself or the ankle itself, but you'll notice that the normal tarsometatarsal glide has been disrupted. Special tests include the lateral squeeze as well as the valgus stress on the forefoot itself. Oftentimes you'll just hear this called the Lisfranc test. Midfoot movement is painful, really not any specific manual muscle test that we will do here. Neurovascularly, blood flow can be compromised and a compartment syndrome can occur, and so you really need to make sure that you check that dorsal pedis pulse to make sure there hasn't been a disruption there. Diagnosis wise, we are going to refer to an x-ray to rule out a fracture. There may just be a separation there without the associated fracture. Treatment can be conservative with the casting. Pretty much everyone I know that has had a Lisfranc injury has had the associated fracture, and so surgical screws have been required for that treatment.